Hi, welcome to another episode of EDTalks. Super excited because we're going to introduce another book. I love books, I love learning, and I love talking to authors and getting some keen insights that you might not get otherwise from the book. So today we have Dr. Doug Slakey. Doug, welcome to EDTalks.
Well, thank you so much. It's great to be here.
Yeah, I've read all about your background. You're very impressive, yeah, surgically and all the different things that you've done. And we'll get into that in just a second. I'll let you sort of introduce yourself. And so we really just met for the first time just because we're both authors. We're both in healthcare. We have some common colleagues that connected us. And I was like, oh, yeah, absolutely. I want to talk to this physician and surgeon and talk about the book because it's such an interesting title and topic in terms of the process manifesto. So I really want to dig deeper into that. But before we get started, just to get to know you a little bit better, tell us about a great customer experience you've had recently, inside or outside of healthcare.
Yeah, well, one of the most amazing things I had recently actually was my publisher did a virtual book launch. And so, like we all do, I sent emails to a variety of colleagues and including some patients because some of my longtime patients who 20 years ago I did a liver transplant or a big pancreas surgery, and it's a blessing they're still alive. But we had over 200 people from 5 different countries.
Wow.
And I will tell you, maybe it's the holiday season or something, but some of the comments I got were just so poignant and really spoke to such a wide aspect of customer service. So I had people who I first started mentoring as medical students, and now they're leaders in healthcare. One is the chief of surgery in Atlanta at the VA, another is the vice chair for research for all of surgery at Stanford. And then I had some patients who, like I said, operated on 17 or 20 years ago, and they're still alive. And just the realization that you actually can have a positive, durable impact on people. Um, and it was so rewarding to see these people's successes and to realize that you me as an individual had even the smallest part in inspiring them to do great things. And so that was really sometimes we lose sight of that, right?
Yeah.
As we work day to day, we sort of lose sight of what we're actually contributing.
Yeah, you're right. We all have the ability, even if it's just one person, to
Right.
have a profound influence on people. And yeah, it's a great perspective.
Yeah. Yeah. It was really meaningful.
What about this is one of my favorite questions. Is there something that your parents forced you to do when you were a kid and you're like eye rolling, and you did it, but now that you're an adult, you look back and say, I'm glad my parents sort of forced me to do that.
Well, besides just making my bed every morning. So I think actually one of the things that they had me do, my father for years worked overseas. He's an engineer, and so he would be gone to Germany. He did a lot of work in Germany. And so being the oldest child and the only boy, I had to do a lot of the work around the house. So I really learned how to repair things and replace things. Um, Around the house that I really now enjoy sort of as a hobby. And it's led to just a lot of fulfillment over the years and being able to do things. And now that all our children are married, it's kind of fun when they call up and they're like, Dad, can you come over and help us do something around the house? So, and it's completely obviously separate from medicine.
Yeah.
So it's just another outlet, but still using your hands and your mind. So although I hated doing all those chores sometimes as a child, it's paid off.
Yeah, but I could imagine even with that though, there that might have been some of the impetus for you to get into medicine and to transplant and surgery
Yeah,
because you're probably like fixing things right around the house and
right.
figuring, hey, I could help fix people too. And
Well, it's true. Actually, it's a funny story. My last year in medical school, when I started, speaking of the, fixing things, I was convinced I wanted to be an orthopedic surgeon, drills and
Yeah.
hammers and all these things. And then I actually did orthopedic surgery my first month of the last year of medical school. And within a week or so, I thought, oh no, I don't really like this because I like the medicine aspect as well. So actually, transplant surgery is one of those amazing fields that involves, surgery, which is highly technical, immunology, long-term relationships with your patients, and then of course a little infectious disease thrown in there also. So really, it was a funny evolution, but
Yeah.
yeah, I'm still a little jealous of my orthopedic friends with their drills and all that.
Yeah, I remember how shocking it was. So I was an anesthesia tech for a while, but I was so shocked when I went into the OR and saw some of the instrumentation. It's like, oh, it just got from Home Depot or something,
Yeah,
and
right.
it was quite an eye-opening experience. But tremendous respect and for clinicians and surgeons and helping people.
Yeah.
So Doug, we already learned a little bit about you, but tell us anything more before we jump into the book about yourself that might help our audience get to know you a little bit.
Sort of understand. Well, a couple of things. One is that one of my passions is I love sailing, and I dragged my wife and children on some long sailing trips when they were young. And actually, I was thinking about this. It goes back, believe it or not, to sort of high school where you do your senior quote. And there's a French author who won the Nobel Prize in 1947 named André Gide. And he has a famous quote that one cannot discover new oceans unless they have the courage to lose sight of the shore. And
Mm.
that's really stuck with me through my whole career. I love sailing because it mixes, obviously weather and physics along with appreciating nature and realizing you can't challenge nature. You have to adapt and be part of it. Um, but then this whole idea of having maybe a little bit of trepidation or even fear sometimes. They say sailors are either bored to death or scared to death, but and I've been in a couple of pretty good storms in my life, unfortunately. But this whole idea that you have to have the challenge to seek out new things. And I think that's defined me a lot in my career is, and not everyone appreciates it, I'll tell you, but challenging the status quo and always wondering if we can't do better, if we can't think of new ways to be innovative and maybe even transformative. Of course, the word disruptive is not well
Yeah.
appreciated in healthcare, even though in other industries it's seen as something that many people aspire to. But yeah, I think it really relates to that, and just being out on the water is always a special treat.
Yeah, I don't have a lot of experience sailing, but I've watched a lot of movies and I've done a little bit of sailing and it looks terrific for all the reasons that you mentioned. What's the longest sailing trip that you've done?
Well, we did a race a couple of times from Pensacola, Florida to Isla Mujeres, Mexico, which is right off Cancun and that area. And that's around 500 miles of racing. You come very close to Cuba and then cut across. And I can tell you, we've just had some amazing experiences on that. It can be absolutely beautiful out in the Gulf.
I'm visualizing a lot as you're sharing your story, and it sounds pretty amazing. So yeah, that gives us a pretty good insight into who you are and type of personality. And I appreciate the fact that you are a disruptor and a transformational type of leader, because as we both know, that's what's really, I think, been missing in healthcare a little bit. And so it's great whenever you run into people like yourself that are actually doing some stuff. So yeah, let's talk about the Process Manifesto. So what was the impetus for writing the book? So tell us a little bit about the book, and then we'll get into some
Yeah.
questions.
So the book, and you're always supposed to hold it up, you know. So it's super, I think, interesting how this evolved. So really the pivotal moment, believe it or not, was Hurricane Katrina when I was in New Orleans. And um, at the end of the day, I wound up staying and becoming the chair of surgery and doing my part to help rebuild healthcare in New Orleans and the Gulf South. And it was a pivotal time because, and this is a bit unusual as a surgeon, I started to realize we had true limitations in access to healthcare. We weren't addressing the needs of people that were living in very rural communities or in our inner cities. So we put various teams together, and we partnered in really unique ways. We put surgery clinics in um, federally qualified clinics that were coming up, which is unusual. No, normally they focus just on medicine. We partnered with inner city and rural churches to do education and screening for things like high blood pressure in at-risk populations, and dialysis access and kidney transplants, and screening for head and neck cancer, things that they were really at risk for that we'd never done before. So it got me thinking about, how do we really look at value in healthcare and improving performance, being able to deliver more services without necessarily increasing cost? So I had all these ideas, and two things. First of all, you know, that's 20 years ago. So a surgeon thinking of value was a little bit outside the box in a fee-for-service model. And so I wound up being able to put a group together which included very diverse people. For example, surgeons, nurses, anesthesia, but all the way up to including people from the transportation industry. One, for example, we worked with Billy Nolan, at the time was the chief safety pilot for American Airlines, and he just finished a period as the interim director of the FAA. So we put this really diverse group together, and we had grants from the State Department and USAID, and we started looking at emerging market countries. How could we help teams? How could we create processes? And anyway, over the years, people would tell me, oh, you have to write a book. And so ultimately I did. And it's really thinking about, how can you empower teams of healthcare professionals to be more impactful, more efficient, more effective without spending a lot of extra money? So creating value, and allowing people to, as I said, really be empowered as professionals.
Yeah, no, that's really cool. What do you hope? Well, I sort of answering this question already, but what do you hope that the book accomplishes? You know, talking about empowering other people, and then it sort of gives a playbook, right? You're sort of helping them how to make this happen.
Yeah, it's you know, it's fascinating. Yeah, and you know, this author journey, you sort of think in your mind, what am I really trying to achieve? And at its core, what I really am hoping is that the book, first and foremost, creates conversations, helps people to think in a different way. I didn't want to write it just as a pure sort of how-to topic, because every environment is different, every situation is a little different. And I do have my 10 core principles, but what I wanted to do was really get people to understand a couple of things. First of all, healthcare is complex, and human beings are complex, and they can't be reduced to a linear, highly predictive model. So one of the first things I argue in the book is that as we've tried to reduce healthcare to sort of an assembly line approach, it's created frustration. I believe it's increased burnout, and it certainly has not, maybe a few exceptions, but has not reduced cost.
Yeah.
So that's a failure. And we have to realize that human beings, we all come with our unique context, behaviors, genetics. And the more we learn about that, the more we realize we have to be flexible and able to customize the way we deliver healthcare so that it's appropriate for the context. So that's the first thing, is to get people to really acknowledge, yes, there is complexity. And then, and this is a challenging hypothesis in the book, with complex system management, I believe the data really shows that you have to decentralize the model. And you have to, that's what I mean by empowerment. You have to push some of the decision making to the front lines of healthcare. And you have to provide people the tools they need, the resources, the information or data, um, and the professional training and education. So critical and has to be ongoing so that people can respond appropriately. And then the final thing, and we can talk more about this, but I was really inspired to include compassion. And that's my 10th core principle, because uh, that's really why we go into healthcare. And I say in the book, and I think this is so true, that at some point in our lives, every one of us is both a patient and a caregiver. And so it's truly a continuum. And it's an inevitable part of human existence. And
Yeah.
if we lose sight of that, we really, I think, don't truly acknowledge and appreciate how important healthcare is.
So, Doug, would you say that if we get so fixated on processes and standardization, to the nth degree, that that kind of squeezes out the ability to be compassionate and empathetic a little
Yeah,
bit?
I think that's right. And I developed that line of reasoning in the book. And I'll tell you one quick story, if I can, that is one of the things that sort of highlights this. So, as I said, I was in New Orleans for 21 years. Did a lot of kidney, liver, pancreas transplants. And one day, my wife and I were visiting some friends that live near the Texas border on the western edge of Louisiana. And we were driving back home on Sunday afternoon, and we had become very close to many of my patients over the years. They still have my cell phone, believe it or not. But there's this little tiny town just off the highway down there. And one of our patients lived there. And I said, let's stop and see this patient. Now, she had had a liver transplant, always came to clinic very put together, very proper, but she kept getting these infections that we just couldn't understand why she was getting this infections. Anyway, my wife and I pulled off the road. We were just going to knock on the door and say hi. She didn't happen to be home, but I will tell you, unexpectedly, the home she lived in this very rural area of Louisiana was what many people might consider basically a shed in the backyard. Um, it, and it was surprising because in transplant and our big transplant centers, we have social workers, we have nurses, and we think we know our patients. But I tell you, that really struck me because I realized that even though we had seen this patient, we had a relationship, we were taking care of her, we really didn't know the context in which she lived. And clearly, when I saw that, I realized this is probably why she's getting these infections, because just the soil, the agricultural area where she lived. And that event in my life really made me think that we can't put every single patient into the same box.
Yeah.
It doesn't work. And we really have to understand a little bit more about them, as you mentioned, with compassion and empathy, to really be able to understand what do they need. And one of the ways I think about it when I speak to healthcare teams, I say, we have resources. We don't have an endless number of resources in healthcare. But if we can actually use strategies to align the resources to the individual patient needs, some may need better nutrition, some may need transportation, some might need home physical therapy for more than the 5 visits that health insurance allows everybody, right? And if we could customize that, we could not only save money because everybody doesn't need everything, but the people who are most at need of specific resources we can actually address. And so that's really such an important component of what I'm trying to inspire with the book.
Yeah. I'm curious, just digging down a little bit more along this line. So yeah, you had this situation, you probably had a few others that really sort of brought back sort of the compassion and empathy. But was there something else in maybe the way that you grew up? Were you wired like this already? Partially, um, was it a transformation that happened in your practice? I was just trying to, I'm always trying to figure out, is it caught or
Yeah.
taught? The whole.
Well, I think it's a part of both, honestly. I think I was wired this way, but I will be perfectly honest that, when you're going through a career like many of us do, you sort of lose sight and you get caught in the kind of maelstrom of day-to-day stress. And, I was, first of all, you're doing high stress surgeries, but then you're also dealing with administration and sometimes these big huge bureaucracies which move incredibly slowly. And it really, I had a couple things. I had a really dear friend who gave me one of the Dalai Lama's early books, The Four Noble Truths. And, part of that is just, well, life's hard. So you got to suck it up a little bit.
Right.
And then, and then I was so fortunate, again, around the time of Hurricane Katrina, I met the person who actually was kind enough to write the foreword of my book, another author, a neurosurgeon named Dr. James Doty, who wrote a book called Into the Magic Shop, which is an incredible book about his life's journey. And he actually started the Center for the Study of Compassion and Altruism at Stanford University, and wound up introducing me to the Dalai Lama in a little small group. And um, it was a few events like that made me take a step back and to be perfectly honest, realize that, well, you can be a little bit of a brash sort of young surgeon, super busy, but uh, that's not that's not enough. And so I think I opened my mind to realizing that I could do better and that I could focus and channel this energy, which was wired to a certain degree, but develop it. And I think that's super important for all of us as human beings to realize that, we're on a journey and we can change the direction and focus on things maybe at different stages of our life, but things that can have an impact in ways that maybe we didn't know previously.
Yeah. That's profound. We could spend a lot more
Yeah.
time. This is one of my favorite topics. And so I always love to get perspectives of leaders. So I think we may have unpacked already the primary takeaway, but maybe not. Maybe what would be the primary or secondary takeaway? What's one other takeaway from the book that you would love for readers to have, you know?
Yeah, well, I think the other thing is to encourage people to challenge the status quo.
Yeah.
So often and I'm just going to speak to healthcare, but in healthcare, we sort of have this propensity to have what I call learned helplessness. So we feel like we're so mired sometimes in the day-to-day bureaucracy. And, we have in many cases um, are faced with time constraints, how long we can spend with a patient, not enough time to actually engage or learn anything about it. As we look at ever shortening things, you hear stories all the time of doctors with their backs to the patient, typing on the computer while they're asking questions that they have to, like, you have your primary care provider and they've known you for 20 years and every single time they still have to say, do you smoke?
Right. Yeah.
Like, well, no, I've never smoked in my entire life, but okay, you've got to check that box. And, 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 I think people sometimes give up and they say, I just can't make a difference as one human being. And so I think in the book, I would really like people to finish it and think to themselves, I can make a difference. I can find other people and I can create teams, which is so important. You can't do it as an individual. You have to create teams and say, even if it's a small incremental changes, we can look at making a difference. And I'll just add one color commentary to that I emphasize in the book is when we're making a difference, we should do it with a focus on the patient journey through their healthcare. Sometimes we look at process improvement and how it benefits us on the provider side of the curtain. And what we really lose sight of is what is the patient seeing during their journey and how can we make that as smooth, consistent, and reliable as possible.
Yeah.
So I would hope, and again, it gets back to this idea that, one of my key goals in the way I wrote the book was to create conversation. I would love to have people sit around a table. This is a
Yeah.
dream to sit around, a conference table in their clinic or in their hospital and say, oh, I read this book and it got me thinking about some things that maybe we could try or do.
Yeah, I love that concept and use it like as a book study. Which I
Mm,
always did as a executive in health systems. Always had active book studies, and we'd pick books like yours and read through them together, and then try to apply different things. No, this has been great. I mean, I can't imagine anyone listening not wanting to buy the book right away because of all the things that you spoke about, and I really appreciate it. What you're doing and how you're doing
thank
it.
you.
Um, and we'll drop in the show notes how to order your book. Of course, it'll be available on Amazon. And how long was people always want to know, like a little bit from authors as well. So I'll gonna kind of pivot now.
Yeah.
Although we could talk about the book forever, it's really good. How long was the overall process to write a book? So, once you got into it in earnest.
Yeah, it really about 6 months um, to really write it. And it was fascinating because I had this phenomenal publicist that really challenged me. And, of course, I sent excerpts, as people do, to a variety of different stakeholders, which was cool because it opened my eyes to realize that not just hospital administrators, but patients and patient advocacy groups might like it. But yeah, like 6 months. And yeah, maybe my surgeon personality, I pushed a little bit more than the publicist. They thought it was going to take me longer. And so,
Yeah.
you know, they would send me something and I would turn it around in 24 or 36 hours, which I think was a little unusual for them. And they're like, oh, he's going fast.
Yeah.
But I wanted to get the message out. And my wife was so kind because when I started this process, I said, well, I've been working nonstop. We got married when I started medical school. So I'm like, I've been working nonstop. What do you think about a short sabbatical? And I'll finish the book and do some consulting. And she was so kind. She said, well, okay, how long is this going to be? Probably around, too much now. And
Right.
she's like, yeah, okay, you finished the book now. Let's get on with it.
Yeah, yeah, I could see that conundrum. No, that is pretty aggressive timeline for sure.
Yeah.
Now that you have this experience, I know it's brand new, but have you already been thinking about the next one, the next book?
Well, yeah, it's funny you mentioned that. Yeah, so I've had a couple people give me their idea for a sequel already. And then I do have this. I've started some notes on a book which is not a little bit more on the fiction side of healthcare, but one of my objectives as I've thought about another book is to point out, exactly sort of what we were talking about, that the learned helplessness, on the other end of the spectrum, the narcissism, and how can we really look differently at our relationships within a large healthcare system, and how can we appreciate that human connection, which sometimes I think we lose sight of.
Yeah.
And so, yeah, I've been thinking about that a little bit. So we'll see where it goes.
Yeah, no, this is fascinating, Doug. It's been great to get to know you. Everything from sort of your upbringing, and then your whole philosophy of life and surgery, and certainly sailing was fun, and then getting into the book. Is there something I missed in our conversation, or anything you want to double down on? I'll give you the last word.
Oh, well, I think if I was going to double down on anything, it would just be my hope that um, when people read the book, that it stimulates them to have a conversation and sort of a call to action, to use a current term. And realize too that there's no one specific path, that you look at your own environment, you look at the local realities and the needs of what you're doing, and put teams together with the idea that you're going to make a difference, even if it's not going to change the entire world, which I don't think there's many of us that can do that, but just our contribution to making a difference can have an incredible impact that we don't even realize in ourselves. So that would be my hope, to sort of double down on that and encourage people.
Yeah, and improving healthcare in a complex world. The Process Manifesto. Doug, you're an incredible person. I can tell, it's pretty clear. I love the fact that we had this opportunity to share your book with our audience. And again, I'll drop the notes on how to get your book for everyone in the notes section. So thanks again for being part of EdTalks.
Well, thank you. It's been a pleasure.